Hi there, I'm Amy Griffiths and I'm one of the journalists in Manx Radio's newsroom, and you're listening to Newscast.
I'm Teresa Cope and I'm the Chief Executive of Manx Care. We've had a pest control issue which we've known about for a few weeks, and as a result of working in conjunction with the Department of Health and Social Care and the Department of Infrastructure, we took the decision a few weeks ago to move Martin Ward down to Nobles Hospital and re-provide that service here for a time. That has allowed the Department of Infrastructure to go into that space to refurbish the ward and to eradicate the pest issue there. And that has been incredibly successful. The ward looks absolutely amazing. And we now have that ward handed back to us. But we need to do the same work across the rest of the hospital. So again, in conjunction with the Department of Health and Social Care and the Department of Infrastructure, we have put plans in place to use Martin Ward temporarily for some services which will remain delivered from the site, and that's our skin service. And some other services, so the blood clinics and the ECG clinics and some of the outpatient services will remain being delivered from Martin Ward. And what we will do is move other services away from the site for a period of time to allow the Department of Infrastructure to bring contractors in to do that work. We are allowing 4 months for that work, and we expect to be back on the hospital site with all services resumed on that site by the end of April next year. We hope it takes less, but in terms of planning for that work, we have made sure we've allowed sufficient time as we sort of head into the Christmas period, leaving time for cleaning and all of the checks, leaving time for all of the work to happen, and then safely returning those services back to Ramsey District Cottage Hospital.
Because just how bad has this pest control issue been if it's closed one ward and it's now closing the rest of the hospital, essentially?
Well, it's been under constant monitoring. So we've all been working to try and eradicate the issue. And whilst that issue is being eradicated, there is a need for areas of the hospital, the ceiling tiles to be replaced and some of that remedial work to happen. So we've been working really closely. We've had weekly meetings. We know it's been safe to continue delivering some of the services there. It wasn't appropriate for us to be able to continue delivering inpatient services there and the work to happen. So again, it's been a team effort to be able to plan how we continue delivering services, but it's really important this work happens for the future safety of services on the Ramsey District Cottage Hospital site.
And are there going to be any improvements done as well as part of this work, or is it purely going to be addressing the pest control issue?
No, there will be some improvements. So as I said, Martin Ward, because the ward was fully emptied, as well as dealing with the pest control issue and all of the cleaning that's associated and making sure it was safe for the ward to reopen, it did give the Department of Infrastructure the opportunity to do some of the backlog maintenance on that ward. So there has been upgrade to the lightings, there has been buffer boards placed, there's been some painting and remedial work. So the ward has been freshened up. And obviously that same opportunity is available in other areas of the hospital which will now be subject to that work. The focus is on replacing the ceiling tiles and doing the necessary cleaning. But obviously, whilst the building is empty, our Department of Infrastructure colleagues are looking at what else needs to happen just to freshen up the hospital. Again, it's a really valuable space for us. It's really important service delivery area. And we want to make sure it's a nice environment. Importantly, it must be a safe environment, which is why we need to take this action. But it gives us an opportunity to just enhance that space.
What has been the cost of this work, or what is the cost of this work going to be, and what budget is going to be used to pay for it?
So I think the work so far has put aside around £80,000 for it. Manx Care is effectively the tenant of the estate. The estate is owned by the government and the Department of Health and Social Care, and the budget is coming from the Department of Infrastructure, who have led on the work to secure the funding for this. So they're probably best placed to answer that question. But we have been supported for that work to happen on Martin Ward, and the agreement and processes in place to be able to repeat that work and make sure the rest of the hospital site is safe.
We are still getting calls from listeners who are really concerned about the temporary closures, and they are scared that this is going to be a way for the hospital to be closed permanently in the future. Can you say categorically now that Ramsey and District Cottage Hospital is not at risk of closure?
It absolutely is not at risk of closure. And I cannot stress that strongly enough. There is no plans to close the hospital. This is, we have needed to temporarily relocate the delivery of some of the services that have been provided at the hospital site in order for this work to happen. It is not possible to do the work while still running services. As soon as that work is completed, those services will return to Ramsey District Cottage Hospital. And as I've said, we expect that to be all back in place by no later than the end of April. So it is important we reassure the public. Our website and the information we have shared talks about where those services will be temporarily located from. So for completeness, the renal service, which is already run from Nobles Hospital, will fully run from Nobles Hospital. The minor injuries unit will be based down at Nobles Hospital as an expansion of the emergency department. The podiatry clinic will be out of Central Community Health Centre, as will physiotherapy. The continence service will be delivered from Mount View House in Ramsey. The full details of where the services are being temporarily located to is on our website, and we have MCALs available to support signposting patients. We've put on things like extra shuttle buses to help transport patients and minimise the disruption and impact on them. Where possible, our staff will move to the new locations, the temporary locations, in order to maintain patient continuity of care. So it has been incredibly well thought through, and we will continue to update the public as we work through these changes. They all come into effect from the 15th, so just over a week away, and we will continue to post information on our websites. But as I say, it's not a decision we have taken lightly. But it is important to maintain the safe provision of our services. But categorically, all services will retain and remain at Ramsey District Cottage Hospital for the future.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.